Hello, my name is David Castaño, and today I'll be presenting on raising awareness on hypertension within the community. So, ever since we started going to the clinic site, and I started doing the hours and started seeing the patients there and helping them and educating them, I realized that you see a mixture of everything. You see a mixture of patients with a hypertensive crisis, patients that are on AFib, patients that were with common cold symptoms, a mixture of everything, which is very interesting. And I found that going to the clinic and being among other BSN students, PA students, MD students was very interesting as well. Hypertension was the topic I wanted to choose because of the fact that it was something that was very common there. Literally, there was many patients, more than one, that would go in there with a blood pressure of 209 over 100. And the first time I saw that, my eyes jumped, because whenever I saw it in the hospital, like, immediately you would just give them, just follow the protocols, or you'll call a doctor and they'll give you orders. So Miami-Dade County is affected by around 36%, I would say, of adults in Miami-Dade County are affected by hypertension. It's due to prevalence of obesity, poor diet, sedentary lifestyle, and according to the Florida Department of Health, hypertension is a leading contributor to many diseases like cardiovascular diseases or a heart attack, which is probably the primary cause of death with these patients. So since Miami-Dade County is such a diverse culture, what can we do? What can we do to help these patients better understand the disease that they have, to better understand and help them, for they don't have a hypertensive crisis and end up in the hospital, or end up having a heart attack. So due to the fact that being in the clinic, you have limited resources, it is a little bit difficult. So why is it important to raise awareness on hypertension? As you can see in the little graph, the American Heart Association has different classifications of normal blood pressure, a little bit elevated, hypertension, and then different stages of hypertension, and then the hypertensive crisis. So hypertension is one of the most common diseases that I would say is very underdiagnosed in Miami-Dade County. It's because of many factors of education on patients or cultural beliefs, since Miami-Dade is a mixture of many different cultures. Many patients are very, I would say, they don't believe that, oh, they have this, they have that. And when you give them medications and try to educate them on the medications, they're not compliant with their meds, which can be an issue later on. Our main goal, besides educating these patients on taking their medications, is to prevent severe complications, like I said before, a heart attack, a stroke, kidney diseases, and many more. So I would say the barriers and assets with the community, so like some of the obstacles that can be faced with the community, is simple. Limited access to affordable healthcare, language barriers. Most of the patients within the community are either American, Hispanics, Creole speaking, so it's hard for them sometimes, especially the Hispanics and Creole speaking, because they don't understand. And as long as, if you don't educate them in their native language, it's very hard for them to understand. Also, since it's different cultures, it's like their practices, like you have to change their diet, change like their lifestyle, and that's something that maybe some of them they're not used to. Some of the sources that we can use are like another clinic I found was CHI, or Community Health of South Florida. They provide free or low cost screenings, and they also educate, and they have fairs throughout the whole year. Another source that I found was public health initiatives, like including the Florida Health of Miami-Dade County hypertension program, which focuses on reducing disparities around the community. So, understanding the cultural diversity within the community. Since I've stated many times throughout my presentation, Miami-Dade is a very cultural diverse city. We have people that are American, Hispanics, Creole speaking, European. We have people from everywhere. So trying to understand or learn their culture should be, I would say, one of our priorities. Because if we are able to understand them better, then we are able to find a better way to help them. So like some examples that I have, like I wanted to focus like a little bit more on diets. So since like Hispanics, they eat like their foods are high sodium diets, so it's like educating them like, hey, instead of eating this typically, let's try to change that. So like one example is like Cubans love eating like rice and black beans. So it's like, let's not always eat that. Let's replace that and go with something with a less sodium intake. So some of the strategies to better control patients with their hypertension is, first, their diet. One of the most common diets is the DASH diet, which is a dietary approaches to stop hypertension, which it focuses on fruits, vegetables, low-fat dairy products. And one of the things that I don't really agree with the DASH diet is like the servings of desserts or sweets. I would educate the patients like to reduce that, to not consume for a while. I know it would be hard, but I don't feel too comfortable with patients still being with on sweets and things like that. Another thing I would focus on is physical activity, exercising, even if it means doing 30 minutes a day, like walking around the block. Starting to do that and slowly incrementing that throughout. Another thing is, which I realized going to the clinic, is a lot of these patients are stressed. I would have never thought of that. Sitting with them and like talking to them is like, sometimes it helps them like relieve that stress, because there would be times I would sit with them and I would talk to them and be like, just a simple like, how's your day been? And that can go a lot for these patients. So what are the expected outcomes I see? If the patients do apply these recommended strategies, I believe that their blood pressure would be lowered. And with that being said, maybe the medications could be lowered too, but it's also if they are compliant with their meds. Their overall health would be better, in the sense of like they would reduce the risk of cardiovascular complications. But what if these patients don't apply these recommendations? Then there is an increased likelihood of a heart attack, stroke, or kidney failure, and a higher healthcare cost, because of the fact that if they're not compliant, then they'll land into the hospital, and that's just gonna be a bill that they won't want to pay or see. So my summary of my personal experience, I wanted to do this slide for the fact that I really did enjoy going to the clinic. I enjoyed working alongside with the PA students, the MD students, the other BSN students. It was interesting. Since we are all students, we are all still learning. Even when we finish school, we're always going to be learning. Learning is something that is going to be throughout our careers, throughout our lives, because medicine is always changing. And working alongside Sean and Kevin and Maylene, it was very interesting for the fact that they're basically our teachers in a way. Like whenever I had a question, I would go to Sean or Maylin, even Kevin sometimes, and they would tell me their input and tell me why, which is something very interesting. Even some of the MD students, like they would teach me certain things that I never knew. That's why I said like I really did enjoy going to a clinic and learning from others, and I really did enjoy this experience. These are my sources.